The war in Gaza has been a war on the right to health and underlying determinants of health. So says Dr Tlaleng Mofokeng, the UN Special Rapporteur on the right to health, who was addressing the media at the United Nations in Geneva today. Dr Mofokeng pointed to the healthcare infrastructure in Gaza that's been completely obliterated, as she warned that the right to health had been decimated at every level by Israeli authorities. On the ongoing humanitarian crisis, let's now bring in Gift of the Givers founder, Dr Imtiaz Sooliman. He now joins us via video link to weigh in on the health situation in Gaza. Dr Sooliman, thank you so much for your time. So Gift of the Givers, as we know, has escalated its work in Gaza, providing, of course, humanitarian aid since the war began. Just let's look at the current situation. I mean, Gaza is facing a severe water and sanitation crisis. Less than 4% of fresh drinking water is available. Just describe to us just your organization and how it's been navigating through the difficult terrain that is in Gaza.
I think your question too well, sorry. But yes, our teams are involved inside Gaza. It's totally horrendous. Taking from you spoke about the health report. There's 35 hospitals, of which 32 are non-functional. And the impact on the health itself, it's physical, it's mental, and there's a combination of factors causing a serious problem inside Gaza. Number one, the absence of food leads to illness, malnutrition. Number two, the lack of water, again, leads to all types of disease. There's large numbers of patients with diarrhea, with hepatitis, more than 400,000 people. Number three, because of the lack of food, any medical intervention is a huge problem in terms of health. Then, because there's no functioning hospitals, there's no equipment, there's no medical supplies, no antibiotics, no analgesics. Everything is a huge challenge inside Gaza. It has been very, very systematic in the way it has been done. Health services were targeted. In other words, hospitals and over 100 clinics were totally destroyed. One of our healthcare centers, our health facility, was also totally destroyed in Gaza. So in a stepwise manner, they first destroyed all health facilities, clinics and major hospitals. The next phase was to start killing healthcare personnel and ambulances. Destroy ambulances. More than 200 ambulances were totally destroyed, and paramedics who take patients to the hospitals, many of them were killed in the process. Then they invaded the hospitals, and the aim was to destroy institutional knowledge. By that I mean people who had years of experience, people who medical personnel who served for years in Gaza and knew how to deal with all kinds of conditions. Those professionals were killed either through direct bombing or abducted or killed. As you see now, they're finding more and more mass graves. They're finding medical personnel who Al-Shifa and the other hospitals they've recently uncovered. And more of the healthcare workers were killed on site or taken away. We don't know where they're gone to. The next phase is to ensure that as part of the regime, allow aid into Gaza. Medical equipment is not allowed. Certain types of medical supplies are not allowed. There's no anesthetics, there's no analgesia. So in the process, slowly, people are getting killed, not only by bombs, but by an absence of medication and medical supplies. And of course, water is critical. Water is required for healing, for health, for feeding, for hygiene, for medication, for washing medical equipment, to be used in ICU, to be used in various areas. Slowly, step by step, the desalination plants got bombed. Even one of our desalination plants has totally been destroyed. And then the desalination plants provide water to take water in water tankers. The water tankers got bombed, so you couldn't take water to the hospitals. Water is also required for dialysis. Kidney issues are a big problem in Gaza. 3 times a year, we send in medical teams from the UK, they do kidney transplants. All those cannot be done anymore. And because of the absence of water, dialysis can't be done. So there's thousands of people affected in that way. And of course, without absence of water then being infected, there's contamination of sewage. Children and adults are drinking sewage-infected water, which in the long run, more people will die from malnutrition and starvation and from infection and disease because of sewage and contamination, and because the sewage plants and pumps have been destroyed and bombed. And in the absence of electricity, because you can't pump the sewage, And because the contamination is taking place, many, many more people will be at risk from death. And so it's not only the health services, the hospitals and the clinics being bombed or the healthcare workers being killed. It is a deliberate process to make sure there's no food, no water, no medication. And in that way, many, many more people will die from the bombing itself.
And as Dr. Mofokeng says, Dr. Sooliman, the psychological effects are, immeasurable. I mean, just in light of that last point that you made, I mean, we are told that even if the fighting in Gaza stopped now, about 8,000 more people could still die there over the next 4 months, let's say, due to public health crisis. How has this especially impacted on women and children, especially because we've seen, pregnant women also, succumbing and leaving young babies behind in some instances?
When you speak to the people in charge in the Palestinian Ministry for Psychological Services, they say it's nothing that has ever been seen before. They say no one will know how to deal with the situation until we get there, and even that's going to be a challenge. Women, of course, 70,000 women were at risk because of birth and, having to leave their babies, or babies have died and they couldn't deliver. That the children that are born are going to be affected for a long time. That's for the pregnancy, the pregnant women. And unfortunately, quite often, you have pubertal psychosis, we have medical conditions or psychological conditions from birth itself, from labor and birth itself. Those conditions are going to be very much more aggravated. And besides the pregnancy part, there are children who are totally traumatized because, when they're sleeping, they're asking, are they hearing the sounds of the bombs? Are the bombs coming? That fear of the bombs coming is something that will take a long time to go away. They've been traumatized by the sound of bombing all over in Gaza. We have psychological teams here on standby in South Africa. There's already 30 psychiatrists and psychologists dealing directly with the Palestinian Ministry of Health and the people in charge and saying, how are we going to deal with the situation? There's just so many situations. Kids who've been amputated, hands and feet. Kids who've lost their whole family. Kids who've lost, parents. And all these children, the number of orphans, no family support, no food. They've been asking, when is it going to stop? When are we going to stop dying? When are we going to eat? When are we going to get water? When are we going to be able to work? We've had aspirations. Can we go back to school? Kids are physically and mentally damaged. And the impact is not just on the kids and the parents and the healthcare workers and the family personnel. On the healthcare workers, sorry, I've just covered many aspects. The healthcare workers, when they work in hospitals, they're working under immense duress, not only because of bombing, not only because they can be taken away, not only because they can be shot inside, not only because their patients will die or will get killed, but they don't know where their family members are. They don't know where their their relatives are. And they work 24/7 with no knowledge or no information about where their family members are. And it has happened so often that when patients were brought to the hospital, the medical personnel found that the dead person was their wife or their child or their uncle or their brother. In one case, a doctor had to operate on his own child in the absence of anesthetic. He had no choice. If he didn't do anything, the child will die. If he does something, the child will go through enormous pain. And he did the operation without anesthetic, and the child died because of the pain. On the one side, you have the physical loss of the child, the loss to the father, the inappropriate, the health services are not adequate. But what about the psychological and emotional trauma to this father? He will blame himself for the rest of his life that he killed his own child. Now, those are the different types of psychological and emotional stresses and challenges that the people in Gaza are facing. And our teams are looking at different modes, different psychological aspects of training, and they're doing continuous training for different techniques, because the healthcare personnel keeps reminding you that all the techniques you have learned, everything that you know, doesn't work yet. When people will tell you PTSD, you say there is no traumatic stress disorder. That thing is that qualification doesn't work in Gaza. These people have been living in a state of constant trauma all their lives. So there's no post-traumatic stress. There's ongoing trauma and stress all the time. You require different techniques. So a combination of, when you're psychologically affected and emotionally affected, even you're physically well, your body gets paralyzed. It can't work. So one of our religious leader, because of the suffering and the torture to his family, just stopped speaking. He just couldn't speak anymore.
Dr. Sooliman, just as we wrap, unfortunately we've run out of time. I know, of course, you respond to the humanitarian crisis on the ground, but when you look at areas that are in conflict, including the DRC, including Sudan, and of course the Middle East, we know that there are those that are funding these wars. I mean, just recently the US announcing that it has approved billions of dollars worth of rands to fund in wars in, to Israel and also to Ukraine. What is your thinking around, these ongoing political decisions that are made that are having devastating effects on the ground?
You see, the Western world, Unati, they're arrogant, they're egoistic, they're genocidal, murder and killing is in their genes. They've done it over and over again. They've done it in Iraq, they've done it in Vietnam, they've done it in Japan. It's part of the genes, imperialism, colonialism, even Mandela was called a terrorist by then. It's part of their makeup to maim, harm, destroy, and genocide in people all over the world. They need to be called out for who they are. The United Nations has become really toothless. It's a body that has to be disbanded. I mean, one country, one arrogant country called the United States can stop an entire process for the entire world and everybody becomes paralyzed. They've done it to Gaza today. They've done it to other countries, and they will continue doing this over and over again. But fortunately, their populations, which are good people, are standing up and saying, not in our name. And we need a mass movement of humanity to challenge governments who are genocidal, who are complicit, not only for Gaza, but all over the world, where humanity stands together with humanity to prevent this kind of chaos ever happening again. We say never again, never again. The Holocaust took place. Rwanda took place, Bosnia took place, DRC is taking place, Palestine is taking place. We need a moral reawakening, a new generation that's ethical, spiritual, full of faith, and who will not allow this kind of disaster to happen in the world again. And for that, we need to remove those politicians, those people funded by the Zionists, those people with big money, who are arrogant and, who will think they can act with impunity, like Israel thinks it can act with impunity.
Yeah.
But we have a teaching.
Dr. Sooliman, unfortunately, that's the time we have for this afternoon. But thank you so much for coming on. Of course, a difficult conversation to have. Gift of the Givers founder there, Dr Imtiaz Sooliman, just weighing in on the ongoing humanitarian crisis in Gaza.